Hi everyone, this is Steven from Enjoy Physical Therapy and Wellness, and I heard that you had sciatica. So I wanted to talk about that a little bit so that we could best help you get back to the things that you want to do. The interesting thing about sciatica is there's actually different reasons for it. Some can come from the back, some can come from a little bit lower into the hip, and I wanted to talk a little bit about that and actually show it to you if that's okay. So here we have a diagram. We have the spinal cord coming down in here and then the nerves going down into the leg. As you may be able to see, in through here is the sciatic nerve and it actually starts up higher into the back. So that could be one of the areas that it could be coming from. Sometimes it could be something from a herniated disc, sometimes from stenosis, degenerative disc disease, a whole bunch of different things. And all of those are pretty common, by the way. Other times it can come down more in the glute area. There's a muscle that runs in from the sacrum and then it comes out into the femur, and right in through there, it's the piriformis muscle. It can get kind of constricted, that sciatic nerve, and it can cause some issues. So it can either come from the back or it can come more from the glutes. And the interesting thing is, if it's coming from the back, a lot of it just all depends on what's called directional preference, and we'll be talking a little bit about that. So now we're more ready for the treatments. First, before we get there, directional preference. I told you a little bit about that. The interesting thing is everyone has kind of their own directional preference depending on how their body is. For some people, it's flexion. Other people, it's extension. So as we're doing these, pay attention to how your body feels. If one feels better than the other, that's your body's directional preference. And of course, we can always go more in depth in a one-on-one personal visit if that's something that you would like. I'm going to lay down and show you some of these exercises. Sound good? So the first one, and if you took a look at the webpage, you probably already saw some of these. But a really, really good one, just to get the pelvis moving, the muscles of the back to loosen up, muscles of the hip and the pelvis to loosen up, is just going side to side. Just go as is comfortable. Now to make it even more comfortable, coordinate it with your breathing. So as you breathe out, go out to the side. As you breathe in, come back into the middle. Just kind of rotate side to side. Do about 20 or so. Okay, another really good one is at the pelvis. What we want to do is a posterior pelvic tilt. And I'll kind of show you with my hands there, and then I'll take them off. And we'll just kind of rotate back, so then our back kind of flattens against the surface that we're laying on. Nice and gentle with those as well. We don't need to lift all the way up. That's a completely different exercise. For now, just a gentle rock. Okay? Now, for that piriformis muscle, there's a few different ways to do the stretch. I'm going to show you a couple different levels. So the first level is just kind of putting your leg up, letting it hang, and just let the knee kind of relax down. Okay, that's level 1. Level 2 is a gentle push down. So then you get a stretch kind of in the back of the hip. Level 3 is going up and across to the opposite shoulder. And there is a level 4, but I'll save that for later if it's something that you need. Each of these stretches you would want to hold for about 30 seconds. Most of the research that I've read says 25 to 35 seconds is when most people actually get the muscle to relax a little bit. And that's kind of what we need if that's the main cause of your piriformis, or the main cause of your sciatica. Okay, so one of the directional preferences is flexion. So if you go up, single knee to the chest, pull up in here, kind of elongates the muscles in the back, stretches out the glutes as well, and can decrease those symptoms. Again, hold for about that 30 seconds, and you can always switch to the other side when you're nice and ready. Okay? Another one, the other directional preference, is laying on your stomach. These are called prone somersaults. Sorry about that. That was a foam roller falling over. So prone press up, first level, just going up on the elbows as long as it feels comfortable. Okay, none of these should cause increased stabbing pain. If it does, definitely give me a call because that's something that we want to work on. Level 2, hands, and then pressing up that way. Many of us, we never get to the level 2. We're just on that level 1. And that's okay. It's kind of what our body needs. After that, we go into stabilization exercises that we need for the hips and the pelvis and the core to keep everything kind of loosened the way it needs to, but also nice and tight and supportive in the way that it needs to as well. There's one last thing that I want to do, and it's just show you with foam roller. So I'll get that real quick. So with our foam roller, we are primarily going to focus on the area of the piriformis and the glutes. It's a very common area for it to be tight and not working the way that it's supposed to. Stretching will help, that single knee to chest. Rolling it with a foam roller. Other people, they use a lacrosse ball or a tennis ball. And then of course you always want to end with just a little bit of strengthening to make sure that it's all working well. So the way that we would do this, I'm going to do my left side, is you angle it so it's kind of on that back pocket. And then you just gently roll up and down. And if you find a spot that is uncomfortable, good, stay there. Just for a little bit until it starts to loosen up, and then go on to the next one. And the reason why we do things like foam rolling, massage, the tennis ball or lacrosse ball roll is because of the way the muscles work. Say you have a knot in there and it's kind of all wadded up and you try to stretch that, it's just stretching against that knot, right? Well, we don't want that. So what you try to do is get rid of the knot, and then you can do those stretches, so then you get that full muscle contraction and that full relaxation as well. There's a lot more that we could go over, but this is enough for now, I believe. We'll get you started. Feel free to give me a call anytime that you need. And also, if there's anything else that you just have a question about, like us to go over, please shoot me an email, and we'll be happy to do that sometime in the future. Thanks.